Hey guys, my name is Kay McDonald, and I'm a master's level athletic training student at Texas Lutheran University. And today I'll be talking to you about an article that I found over Achilles tendon ruptures. The article is called Achilles Tendon Rupture Healing is Enhanced by Intermittent Pneumatic Compression Upregulating Collagen Type 1 Synthesis. I left a link below the title in case y'all are interested in looking more into this. But basically, the purpose of this study was to figure out whether the traditional treatment of a plaster cast or the intermittent compression would be better or beneficial to the healing process of the Achilles tendon after surgery. So materials and methods for this study was that it was a randomized control study. It was single-blinded, so the patients didn't know the treatment, the two different types of treatment, and then it was an applied block randomization. So inclusion factors were ages 18 to 75. It had to be a unilateral Achilles tendon rupture, and they had to go uh, get their surgery done within the first 96 hours or 4 days of the initial rupture. The exclusion factors for this was the inability to give informed consent, current coagulation treatment, renal failure, heart failure with pitting edema, pregnancy, or any other type of surgery within the past month. So the first group was the compression group, and so the patients received 2 weeks of bilateral calf compression after surgery, and then they were able to walk around and be weight bearing as tolerated. The patients record and report the number of steps taken each day, and then the IPC was performed whenever sedentary, so typically at night or just when they're laying in the bed trying to rest. And then from weeks 3 to 6, they were immobilized. For the normal control group, they received the traditional knee plaster cast with the ankle at 30 degrees. They were non-weight bearing for the first 2 weeks and then immobilized from weeks 2 through 6. So they were not weight bearing at all, couldn't walk around, couldn't move the ankle. They just sat there. So the results of this study was that the IPC treatment showed 69% higher collagen formation on the Achilles tendon, which basically means that it was able to heal a lot faster. The functional outcomes were better for the IPC group. There was no significant difference between the groups a year after the surgery, but it was statistically significant when looking at just the first 2 weeks of the treatment. So for the future studies, I would like to go into more ligaments and tendons of the body and try this intermittent compression to see if it would have a beneficial effect, like for ACL reconstruction and things like that. And then for the critique aspect of it, I did not see any type of rehab protocol. I didn't know which group responded better or faster throughout the time. It just had stuff within the first 2 weeks, and then at 12 months, I would have liked to seen like updates along the way, and I didn't see anything on recovery time and when everybody was able to return to their daily lives without pain. But as a clinician, I would use this intermittent compression in order to help promote the healing process of the Achilles tendon and preventing another rupture. That is all I have for you today, so thank you for listening.